Good afternoon, everybody, and welcome, everybody. Distinguished guests, delegates, thank you all for being here to talk about a very important topic that is a priority in all of our work. I would also like to acknowledge all here with lived and living experience of suicide and the understanding and the consideration that you bring to suicide prevention. There have been several side events here at the World Health Assembly this year on digital health, AI, and social media. We are here to talk about this in respect of its potential, its harm, and the importance of safety to save lives, to prevent suicide. More than 720 people die by suicide every year. These are the official numbers. In many circumstances, the true number is hidden, and we're likely talking far more, probably over 1 million. For every suicide, approximately a further 25 people are in need of help, and for every suicide, many more are profoundly affected by the loss of a loved one. We must remember when we talk about these numbers that we are talking about fellow human beings, and I doubt there is anyone in this room today who has not been touched by suicide. When we talk about suicide, we must concern ourselves with the risk factors and how to alleviate these, and also we must embrace the preventative actions and interventions that we can all undertake, from individuals to community, to government, to global level. We must move forward with hope. We know suicide is preventable, and we will save lives if we collaborate and work together. I'm grateful to our partners, Safe Online, Crisis Text Line, and Origin, just Monday announced as a collaborating centre with WHO on youth mental health, and to all of our speakers and panelists today. Thank you for sharing your insights and stories with us. I would also like to issue a content warning. Some of what you hear might be distressing. This is a difficult subject, and we recommend that everyone practice some self-care today. And finally, before we truly begin, please know there are refreshments and food available after the event in the restaurant. First floor, through the bar, turn left. So with that, it was with great respect that I would invite Dr. Mark van Ommeren, Head of Mental Health and Substance Abuse at WHO, to the podium to talk to us about the global perspective.
Thank you all for coming. In a global perspective, what is 720,000 suicides? Let's compare to some other numbers in public health. That is more than the number of people that die every year from HIV, more that die every year from malaria, more than war and homicide together. It's as much as the city of Geneva. So these are incredible numbers. And as mentioned, there's the numerous attempts beyond each suicide. And then there's the numerous people worried every day, but somebody they love will die of suicide. I'm one of those people. So I will, WHO has a well-known initiative, Live Life. It has, I think, anybody here comes from the suicide prevention field background will know it quite well. It has 4 interventions that are highlighted as the most powerful to make a dent in suicide rates. And if I was a real good teacher, I would ask you what's the first one and the second one, and we have an interactive thing. Maybe I should do that. But I won't embarrass you. But the first one, you know, right, is reducing access to means. Does social media and AI have anything to do with access to means? It accelerates access to means. What's the second one? You know, some of you know, some of you don't know. The second one is responsible media reporting. Social media is a media. Does it do responsible reporting when a suicide happens? Does it reduce or enhance the likelihood of copycat suicides? I think the answer is quite clear. Then there's the third intervention. I think actually everybody here should know in the end what the 4 ones are. But the third one is enhancing emotional skills on young people. Can social media enhance and AI enhance? Potentially, yes. Potentially, it could accelerate access to these skills. I say potentially because we're We like to live in an evidence-based world. I'm not saying we have the evidence for that. And the fourth is early care. Can social media and digital approaches accelerate early care? I would say potentially yes. And again, with the potential, I'm not saying it's a fact, evidence-based. So the whole discussion on digital relates to the 4 core strategies that we promote. And so that's why we care. Okay? Then the Live Life initiative, the public health initiative. Any public health initiative has more than just interventions. Interventions, what are interventions? Interventions you need policy to have them. You need surveillance systems to monitor their impact. Is that relevant to this discussion? Yes. What do we need for policy? Well, we like to have evidence-based policy. Evidence in a world that is so quickly changing is not so easy, particularly if you set the standards for evidence quite high. But there's things we know. There's things we can have agreement on. And I would say, for example, where we have agreement on, I would imagine, I haven't checked. But my daughter says to me, you know, it's exam season. I would like to not, I want to watch less my social media things that I use. But if I do and I sign out, I lose all my videos. So it's TikTok. So did she sign out? No. So would it be difficult to change those policies? That should be more possible. What about a more difficult one, but I think that's a much more important one, is the endless scrolling, doomsday scrolling. And I don't use a lot of social media, but the few times I use it, I find myself going in that forever. And in the end, a bit grumpy because it doesn't give me any satisfaction. But this is obviously, when young people do this for hours and hours, this is behavior disactivation. There's lots of psychological theory that explains perfectly well how depression develops and sticks. So policy is very important. Data, we need absolutely the evidence in the data to have much stronger statements and much stronger policy and much more convincing directions as a whole. I would love WHO for us to just say, well, you know, we did an evidence-based review. Here are the 3 things to do. Any member, this is a strong recommendation, and anyone who doesn't do it does it at their own peril, right? And there we struggle. So data, extremely important. I leave my comments like this and give it back to the organizers. Thank you.
Thank you, Mark. So I would like to invite the first panel up to the podium, to the stage. This panel is being led by Maria Manojlovic from Safe Online and features Margaret Mayer from Crisis Text Line and Joe Robinson, President of IASP and Origin, and finally Saisha M. from the Marijuana Health Initiative. Please.
Let's first set up. Okay. No rush. Oops. All right. A little bit slippery, but we're good. Hi, everybody. My name is Maria Manojlovic, and I am the Executive Director of Safe Online. Before I say anything, I really want to recognize what Mark just said, which is I think I'm going to forever now call doom scrolling doomsday scrolling. So we've now relabeled it's a doomsday scrolling. I love it. Thank you for being here today. Thank you to the panelists and our co-hosts and organizers. I think it's a really important topic. And it is easy for me now to set the stage for the panel after Mark and Wendy. But I do want to kind of make a couple of points that will help us frame what we're going to be discussing. First is that when we speak about digital technology, it is not about the tools that we are speaking about, it is the digital ecosystems that are shaping how humans interact, how societies operate, how we form relationships, how we do our business, how we learn skills and do education, socialize, and everything else. For kids, especially who are the natives, there is no difference between online and offline. It is just an old person's way of framing the world. And I think we need to move away from saying and speaking about these things as different phenomena. Digital ecosystems are not only shaping how we behave, they're also shaping through the features, the infinite scroll, the combination of different algorithmic capabilities. They are basically shaping our reality. And we know, you can see that in your families, how you have an uncle who is completely in their own bubble of, let's say, like in Montenegro, of right-wing propaganda, and then you have my, cousin who is completely in the bubble of progressive thinking, liberal, feminist, for example, circles. And they receive different information, they consume different news, they think differently about the world, and we don't share the same reality anymore. So just recognizing that digital ecosystems are not just features, not just social media platforms, not just AI, they do shape how human reality is being perceived and experienced in the modern day. The second thing that Mark mentioned, and I want to just kind of, again, talk a little bit more about, is the state of evidence. Currently, there is a lot of debate and polarization around what is the directionality of what the evidence is telling us. Do digital technologies and ecosystems shape mental health outcomes and well-being outcomes? Is it bidirectional? How do we perceive harm, and so on? And I think, again, we need to be very careful how we speak about these things, but nobody can question the digital ecosystem have impact on human lives, and that they are either vectors of abuse and harm, or they are supporting pro-social interactions. There is a bunch of impacts, but they do exist. For those who work in the online safety space, we see a lot of harm. We see 300 million kids annually being victims of sexual exploitation and abuse. 300 million kids, and this is a tip of the iceberg. These kids have 4 to 7 times higher likelihood of suicidal ideation. And technologies are facilitating how sexual abuse happens, for example, in online ecosystems. 1 in 3 kids experience daily cyberbullying. 1 million kids last year have had their images altered through deepfakes and created sexual materials of them, and that creates tremendous amount of distress. And again, a lot of these kids have suicidal ideation. Some of them do commit suicide as well. So when we speak about these things, this is not hypotheticals, harms are real. I mean to discuss about harms as well. The panel will touch on 2 things today, which I think will give us a good pathway for where we need to be. One is, what do digital technologies, how can we use AI systems and digital technologies in ethical and responsible ways, specialized tools to help us with the issues that we all care about? Faster detection, better response, support services, everything that we need to be doing to actually get where we need to be in terms of the response to suicide and prevention. The second thing is, what do AI systems currently, especially general purpose AI models that have anthropomorphic features, do to our relationships and ability? How do they impact overall mental health and well-being of young people? And what are the impacts of these systems on how kids form relationships, how they create resiliency, empowerment, and so on? Again, these are not hypotheticals. We have all read about the high-profile cases of a 14-year-old boy who had committed suicide because of an intense emotional relationship with a chatbot. The 16-year-old boy who committed suicide through a suicidal coach, as they labeled ChatGPT, his parents. So these things, we know that these systems don't have a good way of responding to harm. So with that, I will ask you, when you speak, be specific when you say AI. What do you mean? Do you mean specialized tool or general purpose AI models? Let's be specific when we talk about it. And then I'm going to just let you give us your best. So with me today, we have an amazing panel. We have Joe Robinson, who is the president of the International Association for Suicide Prevention, and also head of research at Origin. Okay, suicide research, okay. We have Margaret, who is the Chief Impact Officer at Crisis Text Line, and Saisha M., who is a Grants Officer at Mariwala Health Initiative. So let's kick off with, go ahead and tell me a little bit more about opportunities and challenges of AI and digital technologies. And I think Joe, as somebody who's been working with young people on the research side, with professional side, give us kind of a sense of where the things are currently based on where you sit.
Yeah, thanks so much, Maria, and thanks everybody for being here today for this topic. So I think we've been looking at the relationship between social media and suicide and how social media particularly can be used for suicide prevention for about 10 or so years now at Origin. And I guess that work began with a couple of seminal pieces of work where we did some survey work and we did some systematic reviewing that was really kind of looking at what was the potential for social media to be used for suicide prevention. As you said, and as Mark said in his introduction, social media is not a neutral space anymore. These aren't neutral environments. They have both benefits and they have the potential for harms. But I guess where we were sitting at Origin was that regardless of what us as adults might think about these environments, young people are on these platforms, they use these platforms. So we had a responsibility to be there with them and to help equip them to use them safely. So we've done a couple of key pieces of research. We did a national survey over this last year or so, which found that about 90% of young people reported having used social media platforms or AI tools, and including for the purpose of suicide prevention. Around half of them said that had no impact on their mental health. Around a quarter said it had a positive impact, and around a quarter said it had a negative impact. And we'll come back to the harms in a second. But in terms of some of those benefits, you probably know what they are. They're things like fostering connection. They are things like allowing young people to communicate about difficult topics in a way that can be shameful or stigmatizing offline. And there was a really important proportion of young people who were using those platforms in the absence of being able to get face-to-face support. And that was particularly strong in marginalised communities. So in Australia, those proportions were higher in our First Nations young people. They were higher in LGBTQIA+ young people. So I think they provide a really important platform for young people to do things that might be preventative to suicide. When it comes to AI, I think it's different. It's obviously newer. It's moving faster than we can all really keep up. I think, again, to make that distinction, there's, of course, evidence-based AI tools that people are using to help their clinical practice. And then there's the kind of the wild west of AI, so the open AI, which, if it worked well, would have the potential to help people significantly at scale if they're turning to these tools. But actually, we know that they're not necessarily the safest environments for young people, which I guess brings us to the harms. So we certainly know when it comes to social media and increasingly to AI tools, we know we've been worried for a long time around exposure to harmful content, and that can be distressing. At best, it can be distressing for young people, but it can also lead to potentially imitative type behavior. So again, the survey work that we've done has shown that around 75% of young people have been exposed to self-harm or suicide-related content on social media, most of them under the age of 14, and most of them hadn't gone looking for it. So this is where the algorithms actually are doing their work. So young people might go on there to seek help, and might go on there to communicate about something, but actually what the algorithms are then doing is very quickly serving them up harmful content that they don't want to be exposed to. And I think the other point that what we have done, to just mention quickly, is develop some educational resources. There's some copies of these at the back. To really try and help equip young people to manage these environments in a more safe and confident way, I guess, when it comes to talking about suicide, because we didn't want to cut off that important sense of connection or avenue for support for young people. We actually wanted to equip them to use it safely. But I think there's probably some catching up to do when it comes to AI. And I think we've been very focused on, I know we'll get to regulation in a second. We've been very quick in Australia to think about regulation for social media. But actually what we haven't really done, I don't think we've quite caught up when it comes to AI. And we know that young people are using these tools. They're getting potentially instructional content around self-harm and suicide. The tools learn if a young person jumps in there to say, I've engaged in self-harm and it's helped me regulate my emotions. Those large language models learn that actually self-harm is a good thing. And of course, we know it's not. So I think there are some real challenges there. And maybe I'll take a pause.
We can write a book about all of the challenges, like this individual book per challenge. I will just say that I think one of the biggest kind of things that you brought up here is that, and potentially the biggest myth is that the good needs to come with the bad in the online system. So like if you want to make sure that young people can benefit from connection or referral mechanisms and so on, well, sort of you have to kind of like bear with the bad side of things. And I think that is kind of something that we can definitely address. And I think Mark also touched upon that at the beginning. Actually, Margaret, I will go to you. And one of the things that when we were preparing for the panel that you said, which really struck me deeply, was how many kids actually find you, Crisis Text Line, through social media, especially now through AI chatbots.
Yeah, absolutely.
But speak a little bit more about what you're doing and what are the risks and opportunities.
Yeah, thank you so much. Well, first I'll state that the evidence is clear that human-to-human support saves lives in mental health crises. That is known, right? And Crisis Text Line, we use AI undergirded technology to connect human beings in crisis with another real live trained human being who's trained and supported to help them in that moment of crisis. Through our volunteer-powered model, we've supported over 17 million crisis conversations around the world so far in the last decade. In just the last year, over 1.5 million of those in the US. 1 in 5 of those who reach out to us are presenting with suicidal ideation in the moment. So this is a very intense service that we offer and an intense situation that each of these people is experiencing. A key question that we get from those who reach out to us in need is whether the responder is a bot or a real person. They want and need a human being in that moment of need. So we do see a huge opportunity today, though, in that the referral pathway from AI to human crisis support is already forming. Many social media platforms like TikTok and AI chatbots like ChatGPT, Claude, and Gemini are already sharing resources and information like us with people in distress once they detect through their algorithms that this person is in a situation of distress. That's a very good thing. Those referrals should be happening. The risks, though, are that these referrals are happening without coordination or friction reduction, without clinical standards guiding them, and without resources to support those life-saving services that we're providing. Now, our service, we're a nonprofit. Our service is free to users, but it's not free to operate, right? And 1 in 5 young people find out about us through one of these AI systems today. So we're receiving a deluge of people in need that is only growing, and we're receiving and supporting that without the resources necessary to give them what they need in that moment. Meanwhile, and this is a really important thing that I think we can activate together as a group and advocate for, change around, the person in crisis is responsibilized to figure out how to navigate to next steps outside whatever AI platform that they're in on their own by themselves. So the resource might be provided as a pop-up, but then what? It's like tossing a baton in the air, right? So these things need to change.
I think this is a perfect segue to Seisha. I think one of the things that we keep on hearing now, Safe Online is a fund, so we support a lot of we give grants to organizations who work in this field. And we are seeing that now every funder, every donor, every venture capitalist wants to just fund AI tools. So if you say AI, they're going to throw money at you, whatever you say next. But very little investment is going to the human systems and infrastructure. The second big thing is there's this global myth that, like, again, let's do like debunking, that AI is global. Systems readiness is global. You can just go in and like put AI in the hospital, and it's going to be hospitals with no doctors or education with no teachers. I think Seisha can bring us back to reality with what things actually look like in places where these systems can be helpful, but needs much more than that.
Thanks so much for that. I think just as you were saying, I'd like to state very plainly that from Mariwala Health Initiative's position as an advocacy, grant-making, and capacity-building organization invested in rights-based and accessible mental health care and suicide prevention, and as a funder based in the Global South, we see a lot more risks than opportunities at present in digital mental health care and AI for mental health care, as well as the discourse around it. And I think one point is definitely around how the best practices for AI use in mental health today claim that it's best used in tandem with health systems and best used as a referral-making tool for mental health care. However, when there are contexts like the majority world and in the Global South where there are no functioning mental health care systems or very limited under-resourced healthcare systems. What are we doing here by creating these referral pathways like Margaret has talked about? And so there is a deep need to invest just as much into the basic healthcare systems as we are investing into sort of tech-facilitated or digital mental health care systems in the majority world. The other concern that we're seeing currently is, of course, we do say technology is a great lever in healthcare, including mental health care and suicide prevention. And sometimes it's seen as the answer to longstanding challenges of, last mile reach, building mass awareness, and even creating greater access for youth groups in particular. But for digital mental health to truly address these challenges at a global scale, it would require that communities have sufficiently private and reliable digital access and digital literacy on AI, for example, for such tools to be effective for them. Now, for the most marginalized communities world over, those two assumptions are simply not true. So who exactly are we building these systems for is another question I have without too many answers. But yes, another part that's really concerning me lately is that another guidance for safe and ethical AI use for mental health tools is that they should that they're getting better as people are learning to make AI work for them rather than AI working them. And again, the point of digital literacy comes through again. And in that context, if we know that safe AI use for mental health requires that people know how to use these tools, then there's a responsibility for the developers of these tools to work on digital literacy and promote that for the most marginalized communities that they are promoting these services for and trying to work with here. And just one last point, if I may, when it comes to suicide prevention in particular, one use case that is often talked about is AI for prediction of suicide risk and predictive analysis. Now, ask any suicide prevention researchers, some of whom are here with us, and they will tell you that prediction in suicide is a contested and checkered area of work at best. And standardizing the signs of suicidality and risks of suicide attempt in a uniform manner, as many large models seek to do, will not be effective in most of the world simply due to the multi-causal and highly, highly contextual nature of suicide etiology. For example, a mental health condition diagnosis is considered a risk factor in about 80 to 90% of suicide attempts in parts of the global north. It is about 50% in contexts like India. So we have also emerging evidence in India that AI cannot perform this function well at all from researchers and tool developers alike. Again, I ask the question, who are we developing these models for and whose reality will they reflect?
Thank you so much for this. And thank you also for being so to the point and on time. We will shift gears a little bit, and I really want us to kind of consider now what is the scaffolding around these systems that we need? What we have seen in a social media era before AI now is taking the main stage is that a lot of the problems we are seeing in social media we've treated as a problem of content. So we were like dealing with a lot of the issues in terms of regulating content, what the removal, the moderation, filtering, checking, and so on. And that kind of didn't get us into a place where we need to be in terms of regulating features, systems, and more upstream policy choices. We're making the same mistake, I feel, now around AI. AI is being treated as something that we can regulate at the prompt level. What type of output does a prompt give you, and how can you make sure that those prompts are safe? But we are not actually talking more broadly about the systems around it, what AI, interaction with AI systems actually does to humans, more at a much higher level. So let's talk a little bit more about these like bigger upstream pieces. Like, where does the regulation need to be? How do we go from just the potential of these systems to actual implementation and deployment? Margaret, do you want to start from your perspective where that goes, and then maybe we can go, Joe, with you.
Yeah, absolutely. Thank you so much. I think there are three things that I will speak to in this regard. The first is that I think when AI systems, social media, gaming platforms, or AI chatbots, any of those, encounter a user who may be in acute distress, there should be a clear, warm, effective handoff to a trained human. And not a disclaimer, not a list of hotlines that may or may not even be open or in their area, and a facilitated pathway then to a real person. I am also not naive about how difficult that challenge will be, and this is partly why the crisis text line model to me is so inspiring, because we take everyday people in every community and help give them the skills to become a competent and confident responder to someone in need. that kind of that's the other side of the coin. So that's not the technology side, but it's how do we mobilize everyday people, because the workforce is never going to be large enough to meet human-to-human needs, right? We have to find leapfrog ways to do that, and we have a proof of concept that I think is exciting. But going back to the AI systems, they should be required to build those systems and resource those systems. If they are operating with communities and populations, they should reach the solutions as far as they go. The second thing that I want to speak to is that the research on what works is still being written. So we need more clinical evidence on developmentally appropriate AI responses, and we need equity disaggregated outcome data. You were speaking to some of this earlier. And lastly, but maybe most importantly, we need youth at the design table, and we need to mobilize and equip the adults in their lives to be part of the prevention side of the equation.
Amazing, thank you so much. Joe, do you want to go next? Or maybe let's do Saisha, and then you can wrap us up with the higher regulation. Okay, go ahead.
Yeah, I think in terms of regulation, no worries, regulation, governance, and some next concrete steps that we're thinking about around digital mental health care ecosystem. As I've shared, we do have some concerns around, I've not shared yet, but we have concerns also around contextually untested AI tools for mental health from the global north flooding into the global south. And we also have concerns about enterprises, both in the global north and global south, viewing parts of the global south without active regulations, although many governments are taking cognizance as we speak and developing these regulations, seeing our context as a testing ground for AI mental health interventions at large. So in this context, we really recommend regulation on principles of transparency and truth-telling, whether these are apps, whether these are general purpose AI tools, or whatever else comes within the digital mental health ecosystem. They need really clear disclaimers about whether the product has been tested in the contexts it is operating in, what are its regulatory compliances in other countries, in the countries of origin, clear and easy to understand user data policies, that means in human languages beyond English too, and clear information about its success in supporting differing communities in mental health and suicide prevention. And just another word of caution, I think we cannot really deny the dual business interests at play here from both tech and healthcare industries alike. There's an urgent need to regulate the for-profit industry's operations and claims on their AI products. Studies have shown a very high rate of mental health applications, about 90% selling user data to third parties without consent in India. And there's also issues about opacity with paywalls and such. We're talking about mental health data here, right? And there isn't a lot of clarity about what's going on currently. My plea would really be to be very rigorous about the regulations that do come up in these contexts. We often have very strong guidelines on things like media and suicide prevention, as Mark was talking about earlier, but we do see that implementation and enforcement of guidelines of this nature remain really poor. So in this context, we really, I think, need to take it to the next level with our enforcement. And yeah, just final word, I would just want to say this, and not to throw out the role of technology in mental health care. I also hope that we can draw on the history of low-cost tech innovation in the global south for mental health, which predates recent generative AI strides that mimics a lot of the best practices being paraded for AI mental health care now, such as scripted, deterministic, human-driven, and human expert validated, not generative chatbots. These are also highly contextualized in the visuals, in the content, and in the language used, and those make the difference, I think, in how effective strategies are when we think about digital mental health care.
Yeah, I think this all leads us back to kind of like higher level regulation. Governments want to regulate, they want to think about it. Let's not, like, I would love you to give us a little bit more around kind of your thoughts about the social media regulation, but let's go beyond that, because I feel like everybody has been speaking about Australian social media regulation and the bans, which most of us believe a failure of regulating, because that's like, ignoring the problem for 20 years, then you're like, oh no, what do we do? Let's just ban it now. So how do we think about what we learned from social media area, response to regulation, where we need to be in terms of AI?
Yeah, and you're absolutely right. And I think we are already on the back foot when it comes to kind of regulating around AI. What I will say is that we know that the sort of moderating content and relying on platforms to moderate themselves and moderate content doesn't work. They tell us all the time that they've got policies that don't allow self-harm, suicide-related content on there. we know not only is that content there, but it is actively served up to young people. So we know that doesn't work. We did a little bit of consensus-based research a couple of years ago at Origin, where we surveyed young people and suicide prevention experts and asked them what they thought. And what we were really hearing was there's a need, I guess, for a kind of a multifaceted approach, where what we've got is the platforms do need to take some responsibility, and I might come back to that. There was a real call and cry for education so that people were equipped to use these tools safely in the absence of good regulation. And there was a need for governments to step up and regulate properly. And, it is a hot topic in Australia at the moment and around the world around banning social media. And of course, the risks there are that there will be unintended harmful consequences, and you'll shut out. There are real equity issues, and that there's a risk that will shut out people at need and shut down opportunities for connection and drive young people to kind of darker, more harmful, less regulated environments. So we definitely need an evidence-based approach to regulation, and we need to be smarter. I think the other thing that we heard that there's a real appetite for are forums like this. There's global cooperation and global leadership. And I think there's a real role here for us to kind of join forces and think about how do we regulate at scale, but in a smart way. And I think what we can perhaps learn is from the mistakes we've made with social media is how do we jump onto this issue around AI. I think the other language that we hear a lot is around safety by design. And absolutely, this piece around bringing kind of young people and users to the table in terms of designing these tools and these platforms safely. But I have to say, and I'm starting to sound a little bit old and cynical, but having worked with the industry for many years now, there's very limited appetite to engage in safety by design because the commercial and political imperatives aren't there. And I think we have to be really open about that. So as much as we say we need to be co-designing these platforms and these tools with end users, with safety front and center, I think without a political or a commercial imperative, we're not going to be able to bring the companies to the table. And, so I think we just have to sort of see it like it is, really.
Yeah, and I feel like in the AI ecosystem now, there is, again, the rollout happened with no evidence of anything. Mm-hmm. The rollout of these biggest AI chatbots just happened completely unchecked. But I feel like when we say the policies need to be evidence-based, there is currently no evidence, as they say, of acute or big-scale harm, but there is no evidence of absence of harm either.
Yeah.
And sometimes we do allow for these systems to commercially get rolled out. The harms appear much later, and then we're always on the back foot.
I think that's exactly right. And I think even with those evidence-based tools that, clinicians and researchers are developing, they're actually also unregulated. Yeah. And I think there's a real need for us to really confront that.
And to be fully Balkan, to be fully Balkan and depressing about it all, when the whole economy depends on your AI, profits, then it becomes even more difficult, as you say, in terms of conflict of interest to regulate, actually. So we are great on time. We have 10 minutes for Q&A because we do want to be really on time to hand over to the young people. Open the floor. Please, raise the question. Okay, there's one there, one there. Okay, then we can share.
Many thanks for this panel. It has been great. I am Alicia Maldonado, come from Peru, from the People's Health Movement. I just want to emphasize the fact of the industry interest, because this needs to be framed as the digital determinants of health, the commercial determinants of health. And as you mentioned, the big tech industry has a big motivation for profiting with this, the use of data and how it's been sold for commercial purposes, and that this data is specifically this data of mental health is quite delicate. So I think it's also important to that not just think about what regulation is needed, but who we need to take out of the table when it's about regulation, because these big tech industries cannot be influencing policy making. It's I also make the parallel with the tobacco industry, that there's now a whole convention to take the tobacco industry out of policy making for lung health. I think that, of course, this needs to be increased to other industries that are health harming, and the big tech, and of course what they have done with social media, all the health harms that we have already seen in evidence it's health harming, and that means we need to be very careful with the policies. I think I really agree with the policies that are being mentioned in the regulation, but it's just we need to protect them from this interest, and I just wanted to like emphasize that point. Thanks.
Does anybody want to do any?
Would you like to?
Well, yeah, 100% agree. And I think it's a real challenge. But I think your point, we went to a great session yesterday, actually, where we were talking about kind of we talk a lot now about social and structural determinants of suicide or mental ill health. And I think more and more what we're talking about are digital determinants and commercial. And even, I think when I'm feeling provocative, I say political determinants of these things. And I think we just have to be open about what they are. But I think you make a great point.
Thank you. I'm Ong-on Prasan-Panich from WHO headquarters. I have no background in mental health. By the way, I'm a veterinarian. So I have a question about evidence-informed decision-making, a policy. With the speed, how things are going nowadays, so I'm just curious what you think about the evidence that we have today, like might be the evidence of things that have been going on in the past year or 3 years, and then so I'm just curious what you think about when we find the evidence and when we have that policy dialogue, which will also take time, and when the decisions are made. So how do we bridge that gap so that the policy that we are generating address the real issue real time? Yeah, thank you.
I'm happy to start and pass it on. Do you want to jump in? No? Well, I will just say again, this is a real challenge. I think, the technology is moving faster than research can move. I think, there's a paucity of research around this area. So there's a real lack of causal research and longitudinal research, and we really need that to inform smart policy decisions. The work that we did was consensus-based research, which often you do in the absence of having other good research. But I would say that we really do need not only to generate the research and for that research to get funding, so for the funders in the room, where there is a plea for research, for funding that will support longitudinal research that can inform good policy. But we also need the policymakers to listen to the research, and there also needs to be a political will to do that.
Yeah, no, just to add a little bit onto that, I think what we're seeing in certain contexts is like guidances are coming out from apex bodies and regulatory like medical councils for research and things like that, and really, really helpful tools to sort of start signposting. But like Joe has said, we really do need the political will around it. And the research is there for what we need it's better in what we need for suicide prevention. We do know what has happened in digital healthcare in other areas as well. So there is a lot that we can triangulate together, but it is about bringing all those aspects to the table.
And just to add to this, I feel like we are putting ourselves up for failure, because sometimes we actually put impossible standards we need to achieve in terms of research to actually recommend something. So we are saying the standards we are putting ourselves against are really so high that we are basically paralyzed to make any policies. And I think lived experience plays a really important role in that sense. So we need to kind of be much more smart about what do we actually need to do in terms of regulation and not follow these. I think tobacco has learned us a lot in that sense. Work with activists, policymakers, and lived experience to do more rapid policymaking rather than wait for the perfect evidence at the perfect time to inform the perfect cycle of elections or whatever it is. It's going to be always hard. So I think there is something around that as well. Margaret, do you want to?
Thank you. Yes, one thing that I would add to that is that we can't let perfect be the enemy of good or good enough, right? And so I think one of the things that we can do is to be investing in AI ecosystems that design toward human connection versus away from it. And we know that the future of mental health is human. So let's activate more of that side of the engine and also build our evidence base as we go, because that is what we already know. Human-to-human connection saves lives, right? So if we can be activating more of that and getting our AI algorithms and ecosystems to be pro-human connection oriented, I think we'll be in a better position.
Well, thank you for this enriching discussion. I'm Deepak Prabhakar. I'm a practicing child psychiatrist and head of a very large department in the largest health system in the state of Michigan, Henry Ford Health. Really appreciated the differentiating between the global north and south At the same time, it's also one of those unifying factors because none of us are doing it successfully right now when it comes to suicide prevention. All of us have our pain points. I just want to make 3 quick comments, and if you have any reaction to that. On the global north side of it, which is like my current lived experience, there are 2 emerging opportunities. To your point, can AI be better utilized in the surveillance work so that the human resource is a bit more discreetly allocated towards where it's most effective, to your point in the human connection, more screenings and more kind of therapeutic work. And the second is health system kind of appears as if this one size fit all solution, but we all know health systems are very dysfunctional sometimes inside when you look inside out. And there might be an opportunity for AI to link services a bit better to the patients who are in need. And for the global south, I think there is an opportunity where we know there are clusters that emerge, suicide clusters that emerge after a tragedy, after a catastrophe, after a natural disaster, with easy access to means. Again, a lived experience from my earlier life in India, whenever there were floods or whenever there were drought, you would see a spike in suicide numbers closely tied to agrarian crisis in those communities and easy access to means, which is pesticides. So just wanted to get your reaction on those 3 potentials.
Go ahead, please.
I'll start with one example on your last point, and then I'll just pass the mic around. But with respect to how can we use AI to more rapidly focus on accelerating our ability to solve the problem or prevent some of the issues, and then let the human beings focus on that which is innately best for humans to do. One of my colleagues is in the room we've developed an AI algorithm, basically a large language model, that is highly effective at identifying the intended means of suicide. That kind of tool is powerful for the entire ecosystem. As you said, Mark, I mean, one of the top things that you can do to reduce suicide is to remove the means when someone is thinking about it. So this model that we've developed right now is operating both English and in Spanish in the US. That helps us identify the not only the most common and the most prevalent means of suicide by age and other demographics, but emerging means so that we can collect early warning signals. That is something we would love to talk more about with anyone in the room, because we need to propagate these kinds of tools, and I think that's an optimal use of AI. It's not possible for humans to have analyzed those tens of millions of conversations in the way that we now can every single day in live post-conversation identify what those trends are.
You want to go first? No. I think just on your point about cluster suicides and agrarian distress, and is there a role for AI there? I think in those moments, what we found is we still need actors on the ground, right, to reach the communities we're talking about here, because they are marginalized. Even simple technologies like helplines are sometimes not accessible to them in these contexts, right? So again, the point stands about, sure, there might be a role for different kinds of technologies in supporting our data and our work in that regard. But in terms of actually providing the care, we found we really need to work with at the hyperlocal level and at a very human level, as you've been discussing. And a related point to that, if I may, is, thank you. You've talked about agrarian crises, you've talked about flash floods and things like that. The climate crisis, we're also seeing that AI use in general can exacerbate social and structural determinants of mental health and suicide, right? The climate impacts of AI are terrifying. And to run AI tools, including the AI tools for mental health that we might be discussing, data tools that we might be discussing, data centers are being built in our parts of the world, right, which are already facing the brunt of the climate crisis. It's expected that these data centers will worsen droughts and other water scarcity issues. So, and these climate crises have a direct link to, let's say, poor youth mental health outcomes and youth suicidality. So are we inadvertently worsening the social and structural determinants of suicide and of poor youth mental health by saying that we're going to look to AI as the solution in certain things? Just a reflection. Thank you very much.
So as we've added like 76 layer of complexity here, I will ask you now with the one, I'm not going to wrap it up, I'm going to give you all one sentence. What gives you hope? And let's go from Joe here.
Well, I think almost always my hope comes from what young people have to say. So I'm looking forward to the next panel. But also, I think the fact that we're having this conversation.
Yeah, I'm going to say yes, and people who care can be found everywhere. And if we can find a way to activate human beings in every community to be part of the solution, that's a tremendously powerful force for good that is going to be greater than any of the problems we're trying to solve.
Yes, yes, and I think the fact that the youth are asking the difficult questions on digital mental health, on digital technologies, the futures that I can call myself youth adjacent, I suppose, are inheriting, it gives me a lot of hope.
Yes, 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 yes. Natalia, over to you. Thank you, everybody.
Thank you very much to the panel. We just have one more round of applause, and I'm just delighted now to welcome Natalia Brandenburg onto the stage with the youth panel, and she's going to introduce them.
Fantastic. Thank you, Wendy. And I'm really looking forward to this discussion as we dive deeper into the perspectives of young people who should be centred in this conversation. My name is Natalia. I work at Origin in our global team, and I'm really looking forward to this conversation with our 4 young people this morning. I guess we're living in an age where young people are chronically online, chronically exposed, chronically consuming. I was just talking, there was that trend recently where there were like 2 videos playing at once. And because we have short attention spans these days, and we think about the content like new trends like brain rot, where they're just sort of designed to sort of capture us and keep us there. We're turning to social media and AI for connection, for relationship, and to express ourselves and find places to belong. And in times of crisis and conflict, where these tools like the internet and also electricity can also be weaponized against us to be able to access the services that are supposed to be more easily accessed through this online environment. We're also able to reach more young people. Whitney and I are on the WHO Youth Council, and I think our Instagram has over 23,000 followers or something like this, which means that we're able to engage young people at high-level meetings like this in conversations that used to be covered and private. We're able to have them in broader circles and conversations, which are critical to have more young people engage in these. So as we start this conversation, I wanted to first talk a little bit and ask you guys, what's your lived experience of online safety and AI and social media, and how does that really impact the mental health of young people today? I'll first pass over to Tiwa, who is an amazing youth advocate and part of the Global Mental Health Action Network delegation as well.
Thank you. I was really happy that Maria brought up the fact that there really isn't a distinction between the online life and offline life for young people. Like, I've never had a life without the internet. But I think the problem is that suicide and self-harm are so accessible. So in my lived experience, I frighteningly was able to access essentially a step-to-step guide on means of suicide when I was already extremely vulnerable. I attempted to take my life, and the results were almost catastrophic. I think what makes this even maybe more striking is that when this happened, I was already on a children's psychiatric hospital. And so it's scary, the reach that these websites are able to have for the most vulnerable. What worries me, perhaps even more than that, is not just like the existence of this content, but the fact that I feel like digital platforms are now repeatedly exposing vulnerable young people to even more distressing material once they've already accessed it. And it feels like we're essentially trapping young people between distressing content. And I think there's also something to say about the potential long-term trauma that young people are going to have from viewing really distressing things on the internet. and it begins to feel quite like exploitative. However, I want to say that as someone with lived experience, the social media has been really crucial, especially when I was, a teenager. And digital platforms are like a way for so many people to maintain friendships and for communities to be formed, and even inspiration. Like I use Pinterest for literally everything, and I think, and also I think Joe was saying, like, for young people who feel isolated, the internet can be a really, really safe space. And of course, there are worries that come with that in terms of young people who are discussing their vulnerabilities with other young people who are also vulnerable, and sharing behaviors and the dangers of that. But I think that the distinction between those dangers is that platforms and online spaces are they're actively promoting or passively allowing content without appropriate safeguards is so different from young people speaking amongst themselves, and that also being damaging. And if I'm being quite frank, I think that we aren't angry enough, and I think that people there should be consequences for this. Thank you.
Thanks, Tiwa, for sharing your experience. And I think why this is such an issue at the forefront of our lives and the things that we're experiencing every day. Over to you, Adrian. Adrian is a consultant with Brain Health Collective. Tell us a bit about your experience, particularly in First Nations communities.
Thank you. So for me, I get a little nervous, so I'm sorry if I speak too fast. It's hard for me to sometimes separate lived experience, like my personal lived experience, with my professional lived experience as a social worker, and they enmesh quite a bit. So I thought I'd talk a little bit about both today. And so first I wanted to talk about my time. I spent time in Nunavut. I spent 5 years in Iqaluit, which is the capital of Nunavut. It's the Inuit territory of Canada. And I was a youth mental health specialist there. And I wanted to kind of bring the conversation to also what does this look like in remote settings, and where marginalized communities don't have the same access that people in other places do. For those that don't know, so Nunavut is an incredible place. It's an amazing territory. It's very beautiful, and Inuit culture is incredible. I don't speak for Inuit, and I don't want that to be understood. And I don't think of myself as an expert in these things, but I did learn a lot in my time there. And suicide prevention is a huge topic. Suicidal ideation and completion of suicide is, especially amongst youth, is very, very high in Nunavut. It's a very big problem. And so in order to talk about that, one of my projects that I did was the Youth Forum Initiative. So I went around the different communities in Nunavut, and I spoke to kids. So I did about 15 events. I spoke to over 650 Inuit youth. It was the best project ever. I just got to visit cool places and talk to cool kids. And a big part of it is talking about social media, because in a place that has so much isolation, social media is a huge part of kind of the fabric of life in the North, especially Facebook. Facebook is a platform for connection there. So if you want to be able to go to events, talk about your events, talk about your feelings, talk to friends, all the communities in Nunavut are fly-in only, so you have to do it online. You don't get that many opportunities for connections. And so it has some benefits, but it's a double-edged sword. A lot of the kids talked about bullying. They talked about bullying that followed them to the northern store, to their school. Like, they're very small communities ranging from 200 to about 1,500 people. But they also talked about how that was the only way they had to talk to each other. And so it's a way for also, like, there was a lot of collective grieving through Facebook that happened in Nunavut. And so we have to be careful, I think, with some one-size-fits-all solutions, because it doesn't work that way. Also with my work in Venezuela, which is where I'm from, like, we wanted to reach kids in remote communities, and it was through TikTok. That was the way we got, for the first time, kids from every state in Venezuela to access educational services online. And then just to quickly wrap it up, when it comes to my personal experience, I've always struggled with ADHD, and I come from a very wonderful family, but that's very academically focused. And so in university, I went through a major depressive episode, and one of the first things that I did was quit social media. And the reason that I did that, it wasn't because I was experiencing any online bullying or harassment. I've been very lucky that as a queer person, I haven't had those experiences, but I wanted to escape. And I wanted to end things, and because I had a lot of recurring suicidal ideation, and I didn't want opportunities for connection. I didn't want people to help me. I didn't want support. I didn't want my family to contact me. So because of that, I quit social media, because social media can represent that. It can represent opportunities for people to reach out, people to be worried. My mother tried using social media to contact my friends, anything she could do to see what I was doing, but I didn't want to talk to anyone. And so I think if we do get rid of social media, we are also getting rid of some of those opportunities for connection. Thanks.
Thanks, Adrienne, for sharing some of the layers of ourselves as well. And Whitney, I wanted to invite you into the conversation. You're the Youth Engagement Coordinator for the Digital Transformations for Health Lab. And tell us a little bit about some of the work that you've been doing around understanding young people's experiences of being online.
Yeah, thanks so much, Natalia. And also, I don't know about you guys, but this is like hump day on WHA, right? We're halfway there. And there comes a place where you're it feels stale. So I just want to give a big appreciation to this group of organizers for giving us space to share some personal experiences, but also panelists who just chatted with the audience. That's just really cool. So thank you for that. From my side, I just wanted to also pick up on what Maria said at the beginning, that it was 40 years ago that the Ottawa Charter was launched. And it was mentioned actually by Tedros this week that Alona Kickbush, who's the architect of the Charter, and something that was really impactful then and still is today is that health is created and lived by people within the setting of their everyday life. And I think that's something that social media and artificial intelligence has really unveiled to young people, is that it's not something that they're going to the clinics or to the nurse's office, but it's something that's always happening in their hand, essentially. They're seeing it more and they're feeling it more. So I think that's something that aligns with some of the projects that I'd like to share with you guys today. As the Youth Engagement Coordinator, we have a lot of different programs at DTH Lab that range from just networks to more involved roles with regional youth champions. And one of the projects that's being led by my colleague Ananya Choil from India, and also my regional youth champions Nada Zamol from Tunisia and Melanie Kuhn from Austria, is the Being Online initiative. And this initiative is with young people under the age of 30 who shared creative works over several months through this Being Online gallery launch. And although we haven't yet launched the gallery, I do have some preliminary findings that I'd like to share with you guys today on behalf of the team. And what was striking is how visually and emotionally similar many of these expressions were across very different contexts and geographies. Young people are repeatedly representing overload, disconnection, blurred boundaries between online and offline life, and pressures around identity and self-image. But the artworks also reflect contradiction and complexity, some of the points that we've already heard today. Some depict online spaces as enabling friendship, connection, equality, things that may not exist in their offline world, while others used visuals that depict emotional or mental confinement or restraint, feeling of uncertainties, and oftentimes digital life as overtaking the color or the vibrancy of life offline. young people are not rejecting digital life entirely, but there seems to be a movement of expressing a desire to have a healthier relationship and a much better balance with digital life. So another thing that kind of this goes along with is a project that we've been working on around with young people from the global and regional level. And we talked to over 600 young people, so similar to Andrea, but on a global scale, so not maybe as interactive and cool, but we did try really hard. We had a lot of foresight and co-creation elements. And what was really interesting is that mental health was the #1 health priority identified by young people to focus on from now until 2045 at a minimum, as that's the next generation. And what's really enlightening about that is that that was compared to other health priority areas. So sexual reproductive health was the second one. There were also issues we've talked about with climate change and NCDs, but mental health was by far what was the most agreed health priority area from young people. And through these different kind of interactive foresight and co-creation methods, we found that young people really want a system that aims to support their mental health, is a shared set of core values, values that young people agreed are universal and non-negotiable. So amongst different challenges, barriers, health priorities, they focused on shared values. And these values, they really said, are what all systems should be built upon. So a question that came from the back around global north or global south, eliminating those geographies, these core values are: the system must be equitable, trustworthy, humanistic, ethical, inclusive, and lastly, accountable. So digital transformation, as it transforms all areas of our life, young people are putting forward stronger emphasis on the foundational values that unite us, and that these systems should be built to deliver the care and support that young people are actually wanting and needing. I'll share it back to you, Natalia.
Thanks, Whitney. And I think when we think about core values, and it makes me think about, despite young people being digital natives, that being the first generation for that, actually, the internet wasn't actually designed with young people in mind. I visited CERN while I've been here in Geneva, and I found out that actually the World Wide Web was started by CERN, and I'm sure I saw lots of pictures on the walls at CERN, and none of them included young people, I assure you. And so, young people's rights are being overlooked in this space for commercial imperatives. We've heard this already today. And so while at the same time young people are digital citizens, we have the rights to learn, create, and be safe online. And to be able to do that includes having young people really at the center of that conversation in terms of our digital rights and how it looks like to shape the involvement of young people in that. So I wanted to ask the panel today, what does that look like to you? Why do children and young people need to be in this conversation around digital rights and shaping safe online environments? Adrian, I'll start with you.
So yeah, I think, for the last now 7 years, lived experience, engagement, especially in Nunavut and Sense, has been the thing that I love to talk about the most. And I do feel like participation when it comes to the design of programs and services, it's a lovely principle, but it's what really ends up affecting like whether those services will be successful, whether they will help anyone, whether that system will actually work. That's something that I could see very firsthand in Iqaluit, which is a community that's really been damaged by colonization, by models that were never designed for Inuit, but they were designed by others. And sometimes even when they tried to design them for Inuit, it was never with Inuit knowledge. Programs have failed in the North over and over and over again because people weren't being included. Inuit and youth were never included in the design of them. I saw this in many addictions programs. There was no treatment centers that has ever worked. And now they're trying to, they're finalizing the design of an actual Inuit-led trauma and addiction center, and I'm very hopeful for it. And so when we talk about kids, we talk about digital rights. We also have to figure out, or we have to realize that it's more than protection, that it's really about access. It's about agency, it's about self-determination, all these words that we use when we talk about marginalized communities that also apply to youth. And that we have to be very careful about programs that are designed in very paternalistic ways. We know the evidence, this has been talked about a lot this week. We know that programs like DARE for addiction in North America didn't work. We know abstinence programs also have not worked when it comes to sexual health. Why do we think that we can now design something for youth without them telling us what matters to them? We can't. And so that's why I believe in this, because I think I've seen so many different versions of how that doesn't work. I love talking to youth. I love doing trainings on addictions and sexuality and all the different things that scared the teachers that I was trying to help out in the classroom. And it was by having a real conversation with them, especially also because I think as they saw me as a young person, that's how it got to real, I think, safety. So, yeah, thanks.
Thanks, Adrian. And Anne, I wanted to ask you, Anne is the youth delegate for the Netherlands this year, and I wanted to ask you, you know, your current mandate is sort of really bringing youth at the core of the mandate of your country's delegation, and so why is this so important, and why do young people have to sort of be at the center?
Yeah, thank you so much. I would like to start to give you a little bit more background about me. I have a background in medicine, so I have a little bit of experience with mental health and that, and also talking about young people, because I really see the importance of having young people on the table. Because right now we see that decisions about young people's digital lives are largely actually being made without them being on the table. And when that happens, I believe that decisions are actually based on assumptions, and they risk of actually missing the actual cause, and that can actually cause real harm. So I think this panel is already like a great initiative where I'm really happy that we as young people can here share experiences. And I think we've heard some lived experience of what consequences this can have, but I would also like to start to say something of why I think this is so urgent, because social media exposure can really expose young people to unrealistic standards of beauty and success, contributing to anxiety and depression, and it can expose users to cyberbullying, misinformation, and harmful content. Excessive use can also lead to sleep problems, stress, and social isolation. And another key risk that I wanted to mention is the polarization that I see it can result into, because all the algorithms amplify emotional content and create echo chambers, limiting exposure to different perspectives. And this increases division and makes constructive dialogue more difficult. And especially for young people who are still forming their worldviews, I believe this is really important. And the consequences can be really devastating. I visited the Lost Memorial this week, and this shows pictures of young people who took their lives due to the consequences of social media. And I think this shows that it's not just abstract risks, but these are things happening right now to real people, which shows the importance of this event as well. So what changes when we involve young people in it? That is what I wanted to share with you. And as an example, I wanted to give the initiative of Praatpower, in which nearly 3,000 young people were asked what they actually needed to grow up mentally healthy in today's digital world. And what came back surprised many policymakers, but young people said that it's not just an individual problem, but it lives in the environment, in whether their teachers, parents, and friends and communities have also the support to support them. And these solutions only became visible because youth were actually on the table and were able to share what was important for them. So this is not an isolated finding. The evidence is actually consistent. When young people are involved, policies become more effective and more likely to be trusted by the very people they're meant to serve. And young people bring irreplaceable knowledge. They bring lived experiences of what actually feels like to grow up in a world shaped by these algorithms, instant comparison, and constant connectivity. And I think in a world where more than half of the population is under 30, this is not an option, this is essential. Yeah, so that's what I wanted to.
Thank you so much, Anne. I think how do we embed young people at all those levels, because we're experiencing it personally, we're experiencing it professionally, and also we have an insight to provide to decision makers in their planning and implementation. So I guess as we think about, and we've heard a lot of different ideas today around sort of how can we have a safer online digital environment, and what do we need from not just young people, but how do we have young people at the centre, and while working together with policymakers, with parents and families, with researchers and with other services as well, to be able to have a safer digital environment. What's it going to take, and what examples sort of do we have already? Tiwa, I'll pass it over to you first.
Thank you. I think that we place an enormous amount of responsibility on parents and carers, and I think my mom will be happy that I'm saying this. For parents and carers to monitor their children's online activities. But the reality is it's become almost impossible for them to be able to manage alone. I'll give you an example. Before things escalated and I attempted to take my life, my mom found out I was accessing a harmful website. And like the strong woman that she is, she marched over, like physically marched over to the office of our Wi-Fi broadband, and they managed to block my access to the website on my phone, like from our Wi-Fi. But the moment I connected to another Wi-Fi network outside of my home, I could access the Wi-Fi again, like straight away. So my cousin's house next week, I was straight on it. And to me, that highlights the limits of there being sole responsibility on parents, right? Parents, carers, even broadband providers can try, but platforms and systems still hold most of the power on what young people can access. So there's a joint responsibility. Genuine, safe online environments require responsibility from all levels: families, school, policymakers, technology companies, everybody. Like it's a problem for everybody. That's what I think.
Thanks, Tiwa. Whitney, over to you. What do you think from your perspective? What's it going to take?
Yeah, thanks. Actually, sometimes when you're in these talks, you wish that you could record and hear the first part and then the responses, and then formulate, right? Because a lot of what I wanted to say in the beginning has already been really well mentioned and discussed around regulation. Even Tiwa just mentioned this whole of society approach that's really needed. And there are tons of different regulations and policies and even commitments with the UN work with the child rights and everything like this. So something that I just will mention before I kind of go into the co-creation elements is around this analysis that we actually did at DTH Lab around governance approaches. So it's exactly what Tiwa just said, that the evidence is actually showing. And that's that we still place way too much responsibility on the individuals and the families to manage risks associated with the online world. That the ultimate responsibility is still and should be the states and the industry that create these environments for young people. So with having said that, there's still a very strong call for the education and the literacy, which was mentioned in the first panel. And that's something else that we've really heard from young people. the commission put forward that actually you can't just do digital literacy and you can't just do health literacy. You actually need health literacy, digital literacy, and sometimes what's forgotten is civic engagement. So unless the young people are actually participating and feel comfortable and confident to raise their voice, it's not really going to happen. So one thing that I think is quite this question of how, to Nataya's point, a lot of work that we do at DTH Lab is around co-creation. And it was kind of alluded to around co-design in the first panel. But what co-creation really is and can do is provide a concrete action that some of you in this audience can actually take when working with young people. Because what co-creation methods actually aim to do is try to reduce power imbalances. They develop professional skills, critical thinking. It also means you're working with other young people, oftentimes in the flesh, which can create empathy and stronger communication skills, all through kind of peer-to-peer learning. In a recent report that we authored just maybe last week or so, it's around co-creation, a new standard in actually working with young people as partners. And we make a strong case as to why co-creation can be concrete change taken by researchers and organizations working alongside young people. The report includes detailed methods of how to lead co-creation methods. And what we've really actually found, to any of you who are like, what's this hype around co-creation? Is it the next like sexy word we hear at the WHA? I really would try to urge you, to read the report if that's your jam, but really think about what it does for young people who are part of those initiatives. And maybe that's going to ripple through industry or political will. But the experience that young people have in doing these things, it should not be taken lightly. Mm-hmm. It actually really creates an impact. And sometimes that's not always measured for the grant people in here. But it's something that's actually really long lasting. And so what we found is that through these methods, you actually improve intergenerational solutions, you increase trust, and you develop youth ownership in what the findings are. So they feel more compelled to be part of it. They feel more compelled to talk about it with their neighbors or their friends. And those are things that I think oftentimes we overlook, especially in settings like this in the global space. So thank you.
Thanks, Whitney, for sharing. And finish us off. What does it look like to have youth at the center?
To have youth at the center, I think I already said a lot about why I see the importance of youth, but something I might still add to that is that besides having them as representative at a table and it being more inclusive in that way, youth engagement can offer so much more than that. I think that youth bring innovation and creativity, and they have often digital fluency, and their participation also builds agency, a point where you also touched upon. And when young people see their voices are really shaping decisions, they shift from passive recipients to active participants, and that actually shift matters for mental health too. Feeling heard itself is also protective. Not even talking about that the UN Convention on the Rights of the Child recognizes participation as a fundamental right and not actually as a nice to have.
Thanks for sharing. And before I finish this panel and thank the panel for their work, I think one of the things that resonates throughout, and Whitney, you said it before, is, let's talk to young people in the flesh. And so maybe right now, look around the room. There's actually quite a lot of younger people here. I'd encourage you to take a look, and if you're younger or if you're older, look at someone at the opposite side of you, and look at them, make eye contact, and make a concerted effort that once this event finishes and we move into networking, that you'll go speak to them. Because as we said, that young people's experiences need to be at the center of what we do in terms of regulation and implementation. And the best way we can do that is start by the next 10 minutes. So you can start taking that as a call to action from today. So thank you so much, everybody, for your fantastic input.
Thank you. Thank you all. That was a wonderful panel. I just want to invite Margaret back up just to do a few closing remarks.
Great, thank you so much. First, I'm honored and humbled to close this out. I really want to thank you all for giving us the grace of joining us for this important conversation today. This is such a key topic, and it is really great to see this being tackled at the level of the World Health Assembly in these conversations. It's also really great to see such tremendous and warm collaboration that is happening across so many organizations and stakeholders. Natea, Whitney, and Anna, Adriana, and Tiwa, thank you for centering us in the voices and perspectives of youth and yourselves as representatives, but not owning that entire demographic. And Mark, Wendy, Joe, Maria, and Samia, thank you for such genuine and authentic collaboration. Truly, this has been a wonderful experience. Tiwa, you said something that hit me, and I wrote it down. We are not angry enough. And that will stick with me. I will carry that with me. And many other things. Whitney, you also said that the experience of young people engaging in co-creation methods brings multifold cascade benefits. And I'm paraphrasing you, but it's very, very true, right? That's investing forward. So we all have a lot of work to do. There's a lot ahead of us, but we're stronger and more powerful together, and that gives me great hope and inspiration. As a next step, the collaborators from today are committed to following up with a summary paper that we will share with everyone and we'll make available to everybody. And with that, I think I would like to just invite us all to continue the conversation. I love the prompt and the call to action for us to engage intergenerationally as we step from here to enjoy canapes and refreshments in the next room. Thank you so much.